Welcome to Mivaso. I'm Dr. Ahuva Gamliel, a naturopathic physician and licensed acupuncturist. We are here today going to demonstrate an arthritis treatment. We're going to be doing acupuncture on one knee, and on the other knee we're going to be doing homeopathic injection therapy. I'm going to be using a homeopathic called Zeal, which is an anti-inflammatory and analgesic. It's a natural alternative to corticosteroids, and it works excellent for inflammation. So our patient today has had some past knee issues, so this is going to help her to feel much better and have less pain and do acupuncture points that are right around the knee area. This is Zeal, which is made by a company called Heal. It is registered with the FDA, but since the FDA does not regulate natural and homeopathic medicines and foods, since this is a homeopathic, which is a natural medicine, it's registered with the FDA, but it's not FDA approved per se. It's very effective in practice, and I wish more doctors were using this because it lets the body to heal itself from the inside out, as opposed to corticosteroids, which just suppress the symptoms, and the person's pain usually comes back a short time later. And what I like to do is scratch just beside it, which is a distraction technique, and then I inject the medicine right into the joint. Any pain with that, Loda?
Nope.
No. Great. And there's a point on the inside of the knee, which is liver 8, and I scratch and inject, which distracts from the injection. And then there's different acupuncture points. There's one here, here, here. It just really depends where the patient says their symptoms are. So we're going to go under the patella, which is the kneecap, this point here. As you can see, there's no, or very little to no bleeding. And the corticosteroid shots, I've never done them, but I've heard from patients that they can be very uncomfortable. So this is the last one, so we're going to do it on the top here. So now the knee should be feeling really good. And we're going to do a bird demonstration on the other side. They are thrown away after the treatment. They're not autoclaved and reused. That's the law in America. And it comes with a guide tube, and the needles are very fine. They're like the breadth of a hair. They're not like the needles that are used to draw blood from the arm. They're very, very fine. You can see it's like a tiny little needle, and most people don't have any problem with it whatsoever. I insert it into the guide tube, and then I gently tap it into the patient. So we're going to do this on the other knee, using the same points, the acupuncture points around the knee. And I also like to treat distal points. So these are local points, meaning it's the actual site of the pain. Distal points are points on the meridians or channels which affect the knee but are not directly on the knee, such as there's a point by the ankle that's for the kidneys, because in Chinese medicine, when somebody has osteoarthritis, which is the wear and tear arthritis, we want to strengthen their kidney system, their kidney meridians. The liver point. There's a point on the spleen channel as well, right here. Thank you for watching. I'm Dr. Ahuva Gamliel. Bye-bye.